David Gerstel. I'm a physical therapist and the owner of Spectrum Rehabilitation. Today we're going to talk about our Cancer Rehabilitation program. I'd like to introduce you to Aaron Knutson.
My name is Aaron Knutson, obviously. I'm a cancer exercise specialist here and also the program director for the outpatient cancer program here at Spectrum Rehabilitation.
Cancer rehabilitation and cancer physical therapy for cancer patients actually work together, but they're very, very different. Physical therapy for cancer patients involves after someone who has had a mastectomy or a lumpectomy and they don't have their full range of motion or strength in their shoulder. And so basically what physical therapy will focus on is restoring the range of motion and the strength and the function. We work on the scar tissue, we get the rotator cuff strong, and we restore full use of that arm, which after the surgery they don't have. They may be going through radiation, so there's a lot of things that the physical therapist has to work on. So that's what physical therapy focuses on, is restoring function, restoring range of motion, and restoring strength. Cancer rehabilitation, on the other hand, can be done during chemotherapy and radiation, and it can be done afterwards.
With the one-on-one care, it's not as much, there's a physical component where they're kind of getting poked and prodded with a heart rate monitor and with an O2 pulse ox, but a lot of it's just hand walking around, getting them out, getting them to forget about what's going on and get them to progress back into what they've left behind. Meaning, chemo and radiation and just the grinds wears on you. Some are still actively working, some can't because of the fatigue. So what we really try to strive for here is that one-on-one attention. We can really push them where we need to and pull them back where we, just based on the patients.
Well, I went and checked them out. I had cancer, and they said I could get some help, some training, and I checked the 2 or 3 places that they had told me about. And I just went and looked at them all, and the one I looked at centered on people with blue hair and had round balls, and that's all they did was these rubber balls. And I said, I want more than that. So this one looked like what I was looking for. More of a program especially made for people that are post-cancer.
One of the biggest differences we see between our program and obviously the hospitals is once you get diagnosed, the last place you want to go back to is the hospital. So by giving the patients a setting that is non-medical, non-hospital based, kind of puts them at ease, gives them a little break in their life of not having to face it all the time. So along with the physical aspect, which is a big mental component here, that once you walk in, they're just they check their problems at the door. They get to relax and feel normal for an hour.
A lot of our patients during a 6 to 8 week period, their fatigue levels will drop from a 8 out of 10 to a 3 out of 10. Our focus is short term, but we're also looking at long term. And the short term is allowing the patient to regain control over their life as opposed to having the chemo and the cancer controlling their life. And it makes a big difference in their outcomes, makes a difference in their immune system. But long term, we're also interested in how that's going to affect the chances of secondary cancers popping up 5 or 6 years. If we can prevent them from being sedentary and wiped out for 1 to 2 years, by getting them back on their feet relatively quickly, you see changes in their attitudes, their depression decreases, their immune system improves. And if your immune system is, we're all getting cancer on a regular basis, and our immune system simply fights it and gets rid of it. But when your immune system is down, that's when we get a cold, get more flus, and get cancer. So if we can improve their immune system by decreasing their depression, increasing their physical activity, and we're hoping 5 years, 6 years down the road, the recurrence of secondary cancers should be lower. Again, we're going to find that out in the next 5 years or so.
Depending on how everybody starts, is we're surrounded by 17,000 square foot of a wonderful facility. We have everything here at our disposal to take care of, from patients that are hardly ambulatory to fully functioning Olympic athletes. Basically, on part of the cancer treatment program, with everybody and the chemo and the radiation taking such a big piece out of you, you're very deconditioned. So we have some access and some different types of equipment at our disposal here to kind of help jumpstart the recovery process.
Again, you know, we can only talk to, you know, to a certain degree about what we do, and we're rather passionate about it, so we can go on and on about the program. I think a very useful tool for people who are interested in cancer rehabilitation is to look at some of our video testimonials of the people who have been through the program. And rather than us try to convince you, I think listening to someone who has been through the program, who has been in your shoes, makes probably a larger impact. And we have quite a few people who have agreed to talk about their experiences.
It's not about the money, it's about getting the patients back. And that's why we've chose to keep it one-on-one and really limited.